We want to get right to the latest on that coronavirus. The World Health Organization is meeting this morning to decide whether to declare a global health emergency as cases of the coronavirus now surpass SARS.
There are more than 7,700 confirmed cases worldwide. The death toll climbing to 170 in China, where cases are now confirmed in every province in China and in 20 countries around the world.
Yeah, and take a look. Thousands of passengers being held right now on this cruise ship in Italy because a woman from Hong Kong fell ill on board that cruise ship. That woman is now being quarantined as they now test for the coronavirus.
And back here at home, those nearly 200 Americans who were evacuated from Wuhan are now under quarantine at that air base in Southern California. Will Carr is there again for us with the latest. Good morning, Will.
And Robin, all of those Americans spent the night on the base behind me. They'll be cut off from the public for at least 2 more days. And it comes as there's still around 800 Americans in the hot zone in China, hoping to get back to the States as soon as possible. This morning, the novel coronavirus spreading to every province in China and 20 countries around the world. Residents in Hong Kong standing in long lines, scrambling to get the last remaining protective masks. In Italy, 6,000 passengers stranded on this Italian cruise ship after a couple came down with a fever, raising fears they contracted the virus. The couple from Hong Kong rushed to a hospital in Rome. For the first time, we're seeing inside the facility where 195 Americans are under voluntary quarantine after being evacuated from the epicenter of the coronavirus outbreak.
They did a great job of really making us feel welcome here.
Patrick Stockstill and his family say they paid $4,400 to fly on this charter from Wuhan, China, the hot zone, to Riverside County, California.
I've never seen a plane set up like that before. It was a wide open cargo plane, but had passenger seats in it. It felt like something out of a movie.
The family exhausted.
We're hoping to get back home this weekend.
Everyone on the plane is now providing blood samples, and the CDC is rushing to test the results.
We're here to ensure their safety and also to ensure the safety of those on the base, those in this community, and elsewhere in America.
So far, 5 people have contracted the new coronavirus in the United States. In China, at least 170 people have died, leading airlines like Delta, American, and United to cancel some routes. The White House is also considering suspending all flights to China and just formed a task force to help respond. We've also just learned there will be at least 1 more charter flight from Wuhan to bring Americans back to the States. Amy.
All right, Will Carr in California, thank you. Let's bring in our chief medical correspondent, Dr. Jennifer Ashton. And Jen, as these numbers go up, the big question is, how do we put this all into context without panicking?
Well, first of all, based on fact and not fear, but when you take a look at the numbers, Amy, we expect them to go up for several reasons. We're screening, we're able to diagnose, our awareness is up, and when you look for something, you will find it in medicine and science. But it's also important to realize something that we call a surveillance pyramid. So I want you to take a look at this. It's from the New England Journal of Medicine, just out in the last few days. In general, the more mild a virus is, the harder it is to control, because people are less likely to seek medical attention. At the top of that pyramid, where you see higher fatality rates, then it's generally easier to control a virus. And according to this New England Journal paper, what's really important, it is possible for something to be a low threat to an individual, but a high threat to the population.
All right, and we're seeing a lot of those images from China, people wearing those masks. What are your thoughts on
I
the
want to be
masks?
crystal clear. N95s are for healthcare professionals only. The surgical masks are not for well people. They're for sick people to protect others around them. And if you go out and make a rash purchase for big quantities of these stocks, you are not only endangering yourself, because when you touch those masks, you're actually touching your face and increasing your risk, but you're putting healthcare workers at risk. If you go into a hospital and there are not enough masks for healthcare workers, we're in big trouble.
All right, that's a very important warning to think about. And it's not for people who are well.
Absolutely not.
All right.
Can't emphasize that enough.
Thank you, Jen.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.